because I could easily have a stroke. Like, so she's telling me that, and I just immediately start crying because it's just like so scary. Like, she's like, I think we're gonna have to deliver your baby today. Like, she's telling me that, and it really scares me because I'm just like, I'm not ready. Like, in my head, I'm not ready. Like, what do you mean? Like, is my baby gonna make it? Because I'm only 28 weeks. Hey y'all, I'm here to tell you guys my labor and delivery story time on basically like how I had my baby 2 months early at 28 weeks. And I just wanted to like come and talk about everything that I was going through and just give more information on what I was like, the condition, the syndrome that I was suffering from, and what led to me giving birth so early, because I haven't seen, like, when looking it up, I haven't seen many people talk about it. So I just wanted to share my story and, you know, put more information out and shed light on my experience and everything that happened. And basically this give insight on this very big life-changing event that happened to me. So starting from the beginning, my baby was due in November. Scorpio season, the typical like February conception story. So early on in my pregnancy, I really struggled with like trying to find a doctor here where I live, because I've always had like an idea of what I wanted for myself and all these things. Like, I've always wanted like a black doctor, because I know like as a black woman, like there's so many things and there's so much that goes into like having a baby, because there's a lot of prejudice and just a lot of things that happen in the medical field that, you know, I was trying to avoid that and feel a little bit more comfort and ease, because to be honest, I wasn't happy that you know, having my baby where I am, and just seeing the lack of like doctors of color, like women of color, like it really affected me at the beginning. So I eventually, like, I was calling places, like they weren't accepting my insurance. That was a big thing, is a lot of the doctors that I did find, like they weren't accepting my insurance. So I ended up going to a place here called Mom Doc, which is just like a general physician's office. A lot of physician's assistants, like you're meeting with them, you don't really meet with a doctor. So early on, I'm going to those appointments and they're like giving me my checkups, my ultrasounds, everything's going good. But one thing that really like rubbed me the wrong way was the fact of like they kept having me come for ultrasounds, and there's like a lot of different opinions on ultrasounds, on like how many you should be having and stuff. But they would always say like, oh, we couldn't see this part of the baby, we need you to come back so we could see it, you know. Like, so I was going for ultrasounds a lot in the beginning of just throughout my pregnancy journey. And it was really like kind of like questionable to me and my boyfriend, because it's like, are they just trying to run up my insurance? You know, I'm paying all these co-pays and all these things, like just for them to keep saying like, oh, we can't see something. Oh, like, you know, they're doing that on top of like giving me like what is it, like they're doing the vaginal insertion to see my cervix and stuff. So that really was just like very uncomfortable, like just all of that. So that was happening. I'm still calling doctors, like even up until my 28 weeks, like I'm calling because ultimately I want to be with talk to a doctor. Like, I haven't met a doctor this whole time. I'm still hoping for like a black doctor. I'm still hoping for like my dream experience. Like, at this point it's not happening. So that's happening on the doctor end. On top of that, I'm working at my job every day. Well, you know, 5 days a week, 40 hours. And I used to work, I no longer work at this job, which I will be doing a story time on that too, because in the end they ended up screwing me over at this point of like, at the point of me going into labor and me like basically quitting. It ended up screwing me over. But basically I worked my whole pregnancy. I very rarely, until like literally a couple weeks ago, was taking days off. Like, I was very consistent going to work. Like, I was able to handle, like, I wasn't having like bad symptoms or anything. So in my job, like I used to work for Arizona PPE, and they basically we would just like make repairs to like fire suits, and it's like a sewing job. So I'm sitting majority of the, all day of my shift, and that's what I'm doing. And around, I don't even know, like I would say maybe like 26, maybe 24 weeks, I start like noticing swelling, like, and it's very like, at first I'm like, oh wow, like by the end of the day, like my legs would be really, my legs and my feet and my ankles, like my lower legs would be really swollen. And I was just like, wow, like I'm starting to swell. And of course that's normal. Like I would be reading my my baby tracker app, and it was saying like, how normal, like, oh, this week you'll probably start swelling. So I'm like, okay, I'm on track. I'm like doing all the things like normal, like nothing, I didn't feel any different. And a big factor of like that, that things weren't as, like it wasn't anything alarming to me, because I was reading up and it was saying like if the swelling goes down like overnight, and like in the morning if you don't have swelling, like it's very normal, and like all that things. Mind you, at my job, one of the ladies, she was like very concerned, because she was like, oh, like you're swelling, like, basically she's like, have you been eating like a lot of sugar? And like she was like saying like how like preeclampsia is a thing, and like she's dealt with someone who's experienced that, and like, am I, talk to your doctor. And I was like, I felt like she did get, like, it did alarm me a little bit, but I was like reading up on it, and I didn't have any other symptoms of preeclampsia, like no headaches, I wasn't seeing like the little blurry spots, nothing. It was just like literally swelling, and the swelling would like literally be there by the end of my work day. It wasn't like something I woke up with. So I was like telling her like, yeah, I have an appointment, I'll talk to my doctor. Mind you, like I'm just seeing physician's assistants here, like I'm not interacting with any doctors. And so I like tell her like, yeah, and I'm telling her like, oh, I don't really eat that many sweets, because I wasn't, like, sweets weren't really a thing that was like a craving for me. I had more of like salty, like vinegary type cravings, like I was really liking that type of stuff. So I go and I talk to like the lady at Mom Doc, and I tell her like, hey, I've been having some swelling, but I hadn't like noticed that it will go down by the end of the day. And she's like, oh yeah, that's fine, like, basically like brushing it off, like, yeah, that's normal, like swelling is a normal symptom, which is like, I didn't feel any ways about it. So that happened. I continued to like do my thing, work. The swelling would like still happen. My boyfriend would just like rub my feet, and I'll go to sleep, and everything will be fine. And then I'm trying to think of the timeline. And then maybe like about 2 weeks ago, at this point, I started. It was just random. One night I was like home, and I had like eaten some manwich. And a big thing is like my boyfriend, he had brought home some fries, and I was like eating like the fries. It was like a big tray. I had like eaten that, some manwich, and that night I started to feel like really bad, very bad chest pain in my chest. And I was like, wow, like, this is like, I was thinking I was starting to have very bad heartburn. And that night it was so like unbearable. Like I just felt like it was hard for me to sleep. It was just very hard. Like it was a very hard night. I was like telling my boyfriend like, oh, like I have heartburn now. Like, like I'm over here thinking like I had just unlocked a new symptom, and I'm like looking up, all these things. I'm thinking honestly like it was a one night thing. It was a very bad night. Like I could not sleep. I could not get comfortable. It was just so hard. So the next day I ended up taking off of work for the next 2 days, and just trying to like get rid of that like heartburn feeling. And it just wasn't getting better. Like I was looking up so many remedies, so many things, and like I just felt like it was so bad. And on top of that, like I just couldn't deal with like the air conditioning being on. Like I was just very sensitive. Like my body just felt like so sensitive, and I'm over here thinking like, oh, heartburn, like I'm just trying to like do all these like natural remedies for it. So that's happening. And then I'm starting to get like a headache, but I'm still not getting like blurry vision or anything of that sort. And like I don't notice much swelling because I hadn't worked for the 2 days. So I finally get to a point where like like, you know, I feel better. I go back to work after those 2 days and I continue to work. It comes back, like the chest pain, it just gets so much worse. Like I'm like crying at night. I'm like, oh my gosh, like I'm really thinking like something bad is happening. Like I feel like I need to like I feel like my body's not letting me sleep, you know, like I'm going to the bathroom, like I'm trying to like, I'm going like using the bathroom, I'm trying to like, I got in the shower, like trying to relieve it, nothing was relieving me. I'm literally throwing up, but nothing's coming out but like stomach acid. Like that's just like how I felt. Like I had so much like pain in my chest, but it was only like in my chest area, but I was like burping a lot and the burps were very painful. Like it was just a lot of like, it just felt like, okay, I'm like, wow, like stomach acid. And I'm looking up like what heartburn symptoms are, and it's like even some of the symptoms were like a sour taste in your mouth and things like that, which I've been having throughout my entire pregnancy. Like mind you, throughout my entire pregnancy, like a big thing for me was like throwing, like I was very like nauseous, like as far as like if I would go too long without eating, or if I ate like too big of a meal, like I would throw up. Like that was very prevalent in my pregnancy. So I was like, you know, used to throwing up, especially like after I ate sometimes. Like I would just, or while I'm eating, like throw up, and I would just like go about my day, continue eating. Like it was normal for me. And oh, let me backtrack. So going back to like a couple weeks, like around the time of my swelling, I go to a mom doc and the lady tells me like, hey, like they did the ultrasound and they're like, they've been like, well, for the past 2 ultrasounds, we see that your baby is not, like, she's behind in her growth. So I'm like, in my head, I'm like, okay, so this is the second ultrasound. And like, why didn't you tell me this, you know, the last ultrasound, which is like 2 weeks prior? Like, why are you waiting? Well, I guess they thought, like, maybe they thought she would catch up and like, you know, I know it's normal for babies to measure like sometimes a little small, yada, yada, yada. So they're like, we're gonna send you to a specialist, like a specialty ultrasound people who have better equipment to see like more. So around the time of I start feeling bad, I have an appointment to go see these specialty people, and that's that. Mind you, like my boyfriend, he's very like skeptical. He's like, they're just trying to get more money out of you, like blah blah blah. Like as far as like, you know, like they've been having me do all these ultrasounds, and you know, like he was just like, okay, like, you know, is this really something, or is this just them trying to like, you know, make, you know, put more fear into you, which it really did like have me scared. Like I was crying because it's like, it's just so nerve-wracking. Like just hearing that is not positive, and like it just really hurt to like, I'm in my head, I'm thinking like, was this something that I did? Like, you know, like me working my whole pregnancy, like it's just like me being hard on myself, like, you know, was it something I did? So basically, like I start feeling bad, like I said, like the heartburn, look at this heartburn, the chest pains, like the headaches. But these headaches would only happen like at night. Like I would go to sleep with the headache, and then I would wake up the next day and be fine, and like my chest would feel better too. Like I was only noticing the chest pain like towards the evening and night times, which was another symptom of heartburn like that I was reading. But I also kept seeing like possible preeclampsia, but I wasn't having any other symptoms with that, like nothing besides the headache. The headache started coming, but they weren't like consistent. No blurry vision. Like I was having nausea, but in my head I'm like, okay, like this is just really bad heartburn. Like my baby's about to have like a lot of hair, you know. Like I'm just thinking I need to change my diet, you know, because this whole time I've been eating a lot of spicy, you know, things and all these things. So that happens, and I'm getting to the point where like I'm not going to work. Like I had given my 2 weeks notice because I had already had a plan, like, hey, like by this day I'm ready to stop working. I want to focus on getting things ready for the baby. Like I want to start focusing on, you know, being in my nesting mode. So I go, I give my 2 weeks on a Friday, thinking like, hey, like I'll finish out the next 2 weeks. But by the time Monday rolls around, I take another day off. I'm still feeling bad, like nothing's helping, like antacids, Tums, none of it's helping. Like, so I'm finally like, okay, like, you know, still thinking like it's just bad heartburn, like nothing's really helping it. I'm taking antacids, like I'm very skeptical about doing all that. And it just gets to a point where I'm just like, okay, I can't make it into work. And the owner of my like place of work is telling me like, okay, like, you know, basically like, are you still coming in, or should we just like take that Friday as your last day? So I'm still thinking I'm coming in, and that next Tuesday it's still not better. Like, I'm still feeling bad. I'm still trying to combat it, and I'm just like, I'm just gonna say Friday's my last day. Like, I couldn't make the 2 weeks because I was like feeling so bad. Like, nothing was getting better. The chest pain, all of that was just very unbearable, especially like at night. So it was like affecting like my sleep, and just like I felt tired. I felt like disgusted by literally like everything, like food, the smells. It just made my chest hurt. Like, everything was bad. And I was like noticing, like, when I would go to sleep, like I would sometimes wake up and my heart was beating really, really fast, and I was just hot. Like, I would be like really hot or really cold. Like, the air conditioning was just like so making me so uncomfortable. So I would like, you know, I prefer being hot, stuff like that. I have the headaches like at night, all these things. Mind you, my baby, she's still very active. Like, she's kicking. I feel her. Like, you know, I know that she's good because I feel her. Like, so I'm not, in my head, I'm not like that nervous about like anything of that nature. But by that Tuesday, I had like told them like I'm done with my job because I couldn't make it in, and I could tell that, you know, you can tell when people are over you calling out, and they already know that I'm pregnant, you know. So I was like, at this point, I'll just, you know, end this and focus on how I'm feeling. So that Wednesday I had an appointment, and me and my boyfriend were going back and forth, and we're like, you know, like, do we think that, basically we're just like, okay, like, is this gonna be a beneficial appointment, or is this gonna be another thing of them just telling me like, hey, we can't see something, or like, you know, just trying to keep getting me to come back. So we decided to go, and I go to the appointment at the specialty place. So I get there, they take me back for the ultrasound, and the lady's like doing the ultrasound, and she's like looking at everything, and she stops and she's like, well, I'm gonna go talk to the doctor because I think she said your amniotic fluid is too low and I can't see everything I need. Like, basically she's having a hard time seeing what she needs. So she goes and she talks to the doctor. She comes back to me, and she says like, hey, like, you're gonna go speak with the doctor, like, you're gonna go speak with her. But another nurse comes in and she takes my blood pressure, and I go back and speak with the doctor in her office. So we go back to the doctor's office, and she just gets really serious with me. Like, she's like telling me like that basically I'm in danger of like my blood pressure is extremely high, like way higher than it needs to be. They can't see what they need for the baby, and that I need to go to the hospital like immediately, like to the point where like she's suggesting I go in an ambulance like immediately to the hospital. Like, she doesn't want anything to trigger my blood pressure anymore because I'm at risk. I'm at risk of having a stroke at this point. Like, she's telling me like my blood pressure is way too high, like I'm at risk, anything like that I need to be very careful because I could easily have a stroke. Like, so she's telling me that, and I just immediately start crying because it's just like so scary. Like, she's like, I think we're gonna have to deliver your baby today. Like, she's telling me that, and it really scares me because I'm just like, I'm not ready. Like, in my head, I'm not ready. Like, what do you mean? Like, is my baby gonna make it? Because I'm only 28 weeks. Like, today, like that day, I'm literally making 28 weeks, and I'm like, I have to give birth. Like, they're already saying my baby's behind, she's small, and they're telling me like she's restricted in there, like she's not growing, she hasn't been growing for over a month. Which in my head, I'm like, you know, blaming. I'm in my head, I'm like, is this mom talk? Like, did they know this? Did they not tell me? Like, I'm just like going through all these scenarios. My boyfriend's there with me, and he's just like, you know, like we're trying to make the decision of like, do I take an ambulance? She's telling me, like, giving me options of like hospitals to go to, like what's closest, like what's best, what takes my insurance, like all these things. So they go back, they, you know, they give me like tissue to get me to calm down. Like I'm crying, I'm nervous because I'm not ready to have a baby, like especially this early. Like I'm just thinking about my baby at this point, like, and me, because I'm at risk of like, I'm at risk of a stroke, you know? So I go to, me and my boyfriend go back, they take my blood pressure, it's even higher. It's at 200, it's in 200 at this point. Like the top number is 200, and they're telling me like, you need to go, like the lady's about to get me, like she's like, I will, like, you know, like you can get airlifted, like she's ready. So I'm like, okay, we're gonna drive, like we're gonna go there because, you know, I'm just thinking like we can make it to the hospital. So my boyfriend drives me, we make it to the hospital, we pick which one we're going to, we go there, and we go to the labor delivery, and I tell her like, you know, I'm, you know, freaking out because in my head I'm like, I could, you know, I don't want to have a stroke. And the doctor, she just made it seem so serious when she was talking to me, like this is urgent, da 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 da. So I get to the hospital, I have that same level of urgency with the lady, who's, mind you, she's like, calm down, like, you know, just giving me like chill vibes, and I'm just like, you're telling me to chill, but I'm at risk here. So I get checked in, they take me to triage, and I'm just like laying in the bed. You know, they're putting monitors on me, they give me an IV, all of these things. They're just like monitoring the baby. Mind you, they're having a very hard time like finding her. Like they give you like the belly band to monitor like her heart rate and all that. Mind you, like her heart rate's been strong this in my entire pregnancy. Like it's always been a thing of like pretty strong. Like she's been good. Like she's very active in ultrasounds. Like she moves, like I would feel her move. There would be days I wouldn't, and of course I would get, you know, nervous, but she would always like be kicking, very active. And I also like found out that day that she had turned head down. So I'm like, oh, this is great. Like thinking like, oh, like she's ready. Like she's starting to be in a good place for like labor, because of course I'm planning to have like a vaginal delivery, all the things. Like that's always been my jam. Like I've honestly always wanted to just have a natural birth, a water birth, which water birth wasn't gonna be a thing because we live in an apartment, 1 bedroom, like there's not enough space for that. So that's already one thing that's like check, like, you know, crossed off. So I'm like, okay, next thing would be like a natural birth at a hospital. Like, so that's what I've always wanted. So I get into the triage, they do everything like I just said. My boyfriend's there, we're just waiting. They're like, you know, trying to find her on the monitor. They're having to like do a lot just to keep her like heart rate on the monitor. So I'm waiting for them to like get all my information from like mom doc and like the doctor I just came from, for her to call over, which she said she'd call over and like let them know everything that's happening. So like that happens, they start giving me like magnesium in my IV, because one of the things that I was experiencing was very high blood pressure, and the lady was saying how like I was at risk of having like, you know, either a stroke or a seizure because of how high my blood pressure was. So the magnesium was supposed to like help counteract that and keep me like more, you know, balanced and bring my blood pressure down. But the magnesium also was making me like, makes you more like, just like, I just started feeling really hot and like just drained. Like I was really hot in there. I was just like, oh, I'm so hot. Like it's making me feel hot. It makes you feel like just heavy. Like you're kind of like high in a way. Like it's just very heavy. So that's happening. Like people are coming in, like, you know, doing all the necessary tests. I don't know, I'm having a hard time like remembering like the specifics of everything in a triage part, but basically I'm in there, they're checking baby, they're having a hard time. Like they're literally giving me like, doing like ultrasounds of her just to make sure she's good, because they're having a hard time like keeping her heart, like keeping track of her heartbeat in there. So that's happening, and then in comes like a doctor, and he's like, hey, he's like the on-call doctor for that night, but since I was such a high risk, he wasn't the one that was gonna be like doing anything, performing anything on me. So he calls in another lady, and she's like comes in and she's like she doesn't know the gist of everything yet, but she's like, just telling me like, hey, like, this is like what I am, this is what I do, like I deal with high risk, all that stuff. So that's happening. She's telling me like, hey, if we can't get your blood pressure like stable, get you stable, then, you know, you're gonna have to deliver this baby like sooner than later. And the most she was giving me was like 2 days. Like, she's like, it may be 2 days, like I might be able to like, you know, get you to a place for like, get you stable for like 2 days. But if that's not the case, like, I will be delivering your baby like today, which is just like, at this point I'm just like, you know, like I've come to the terms of like, I'm gonna be delivering my baby. Like, my baby's not gonna make it to November. Like, I need to get my baby, like, they need to get my baby out for me, not only for her, but for me to survive. Like, it's not like this pregnant, like my baby is affecting me. Like, my body is starting like to, you know, be in distress. So basically, like, she's telling me this, and we've been there for like maybe like 30 minutes to an hour, like at the hospital. And my boyfriend, his phone died, so he said, I'm gonna go home and get chargers and stuff. Mind you, like, I have no hospital bag, nothing packed. Like, this is all like, literally, we go to I had a doctor's appointment. They told me I was in an alarming space, I didn't go to the hospital, like my baby could be delivered. We went to the hospital. So like, this nothing was prepared, nothing. So he's like, goes home, he leaves to go home, and I get up and I'm like, I tell them like, I need to pee and stuff. So I go to the bathroom. And as soon as I come back from the bathroom, they're trying to hook me up. They're trying to hook me up back on the stuff, like back on the monitor or whatever. So after that, they're losing her, like they're losing my baby, and they're having a very hard time finding her again, and it starts to get alarming for them. Like, at this point, they put me on oxygen to try to see if that helps with finding the baby's heartbeat, like helping her be able to be monitored. The doctor's coming in and she's like so alarmed, like they're like, she's just like, you know, when people, you can tell that they've just like given up hope that things will get better. That's the vibe she was giving me. Like, she was just like, she already knew like what it was that I would need to like deliver my baby like today. So my boyfriend just left, right? It hasn't even been like 10 minutes and all of this is happening. Like, they can't find the baby. They're starting to get alarmed. The doctor comes in and she's telling me like, you have HELLP syndrome. Like, she starts telling me about like HELLP syndrome, which I'm going to like give a little bit of information on it. I have on my laptop like what HELLP syndrome is, because honestly, like, it's very rare. Honestly, I never, like, no one, I watched YouTube like through my whole pregnancy, and I was watching like all types of like, you know, preeclampsia, which I know preeclampsia is a thing, which this is a form of preeclampsia. But HELLP syndrome, spelled HELLP syndrome, is a rare pregnancy complication. And I'm gonna put like these little inserts on the screen so like people can read it. But it says it is a type of preeclampsia that causes elevated liver enzymes and low platelet count. If you experience signs of HELLP syndrome, get care right away. Many women with HELLP syndrome need to give birth early to prevent health complications. And some of the symptoms are, syndrome is a separate disorder from preeclampsia, as patients may not have high blood pressure and like protein in their urine. It can lead to serious blood and liver problems. And it says there is no known cause. Women who have preeclampsia or eclampsia have a higher risk of HELLP syndrome. Up to 1 in 5 women who have preeclampsia or eclampsia develop HELLP syndrome. So it's like, it's nothing, it's no known like cause. It's just like a random thing. So that was a lot of like, that's what some, like, they stressed me like, this is nothing, this is not my fault, because I was really feeling like this was like something that I did. Like, was this, you know, like I already had so many things in my pregnancy that were just like, you know, not how I wanted things to go, that I felt like, oh my gosh, this is just like a result of me, you know, not having the best habits during pregnancy, like me working, sitting for long hours. Like I was just like, wow, like is this something I could have prevented? But it's not. And it says that a lot of the it says other risk factors for HELLP syndrome include age. Your risk increased over 25 if you've had it in a previous pregnancy. It says that white women are at higher risk as well, but I don't know. But these are the symptoms of HELLP syndrome. So the most common symptom is abdominal pain, usually in the upper right quadrant of your body, which I was feeling pain, but I didn't associate it with just the right side of my body. So I wasn't thinking like, oh, you know, so I was having that upper abdominal pain. Blurred vision, which was one of the things I kept looking for, but I didn't have that. It says fatigue, which I was, edema, which was the swelling, but I wasn't having much swelling. It would only be after those long days of work, and during that time I wasn't having like the chest pain as well, and quick weight regain, which I didn't really have. Nausea and vomiting, which I did have, and less commonly blurred vision or headache, which I was having like a little bit of headaches. And then it said in rare conditions, you may also experience uncontrolled nosebleeds, seizures, and uncontrollable body shakes. So those are like some of the symptoms. Basically, it's just like having like very elevated blood pressure and having like, it affects your liver and kidney functions. So the lady was telling me like, the doctor was telling me like, you have HELLP syndrome, like we need to deliver your baby in order for you to like survive. Like this is a must. So my boyfriend, like I said, I just left. I go to the bathroom, I get back in the bed. They can't find her. Like they're having a hard time keeping her on the monitor. The doctor's telling me like, the doctor is giving the energy like there's no more hope for this situation. Like I need to deliver ASAP. So they start getting me ready. And comes the anesthesiologist telling me like, hey, I would prefer to give you like basically an epidural than to have to put you to sleep, you know, like telling me all this. Mind you, there's not enough time. Like they literally will start wheeling me into the ER, and I'm not even getting epidural, which I was happy. I didn't really want epidural. Like I just didn't want that for myself. So they're like, they're gonna have to put me to sleep. There's not even enough time to give me an epidural. Like my baby needs to come out now. This is literally, again, like I said, 5 minutes, not even, after my boyfriend had left. Like it gets serious that quick. And I'm like, in my head, I'm so like, I'm scared, but I'm just like in this belief that I'm like, is this real? Like, mind you, I'm still on all these drugs. I'm like, is this real? Like, I'm scared because it's like so crazy, like how right after my boyfriend left, it's like, okay, we need to get this baby out of you, da, 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 da. I have no one to advocate for me. Like I have nothing, it's just me. Like I'm by myself, and it gets serious. So they're wheeling me in. One of the nurses is like, her boyfriend just left, like we need to contact him. I'm trying to text him. Mind you, he went home because his phone was dead. So I'm just like, I call him straight to voicemail. Call again, straight to voicemail. The nurse is like, I'm trying to give her his number. I'm texting him real quick, like, hey, like they're taking me into labor, like, and then I'm like, they're gonna put me to sleep. Like basically those are the last things I say as they wheel me in. They wheel me into the OR. They transfer me onto the bed. They lay back, I look up, and all I see is those lights. Like all I see are lights. They're telling me like, hey, we're not gonna put you to sleep yet. I can feel them putting like the what's it called on me, like that like brown stuff. Mind you, I still have my shirt. Hold on one second. I still have my shirt from when I was in the hospital, because literally like the only thing I had to take it off was my underwear and my pants. I had the gown, but I still had my tank top on the whole time, like even until after labor. Like my tank top was on, so I have it. I can show you my tank top from birth. Like this is the stuff that I can feel them like putting it on my stomach, getting me ready. So, and I'm keeping this souvenir, you know. But basically all I see are those bright lights, and I look up and I'm just laying there like they have the mask on me, and they're like, we're not gonna put you to sleep just yet, you know. they're gonna wait a little, they're just waiting, like they're preparing me. And then all of a sudden I just, you know, the last thing I remember are the lights and then putting this liquid on my stomach. So I wake up, or I'm like, by that time, like my boyfriend, he said he had gotten my text. He like, by the time he got home, he, you know, charged up a little bit. He's racing back. And I even asked him before, like I went to sleep, it's like, will my boyfriend be able to come in here? And they're like, no, but he can go with the baby. Like he'll be able to go with the baby after. So that happened. I literally have no memory of anything. Like even I think like a little minute after, because my boyfriend has videos of things and I don't remember any of it. Like he has a video of me sitting after eating ice. Like there's a picture, like there's pictures of me, him and the baby, like in my last vlog picture at the end of that video. I do not remember any of it. Like I don't remember nothing. Literally the last, I just feel myself wake up and I'm in like, I guess it's like the recovery part. There's like a nurse there, my boyfriend's sitting there, and I just feel like a brand new, like I just feel so different. Like I just feel like, obviously I feel better than I had before. Like, you know, all that, just me feeling so shitty before, like it was gone. I still haven't seen my baby yet. Like I don't, you know, like I think like based on pictures and videos, she's been there like around me, but I don't remember. So I'm sitting there, the lady's like just like talking to me, like she's getting me talking about like breastfeeding and like pumping and all these things. Like she's talking to me about that. She told me like, oh, they're gonna put me in like a room, antepartum, like they're putting me in a room. I have to be in a room. I finally get to go to the room, and you know, I have like a catheter and all these things in me. Like, so I do remember them putting in the catheter. They did that in like triage. So I had like a catheter and stuff, all that, and I'm still on magnesium. So like I can't really like walk, you know, on my own, and I'm still feeling like kind of like just really like heavy. Not really as hot anymore, but just like heavy. So I'm in there for a little bit, like in that middle waiting ground. Just I wake up and I just feel like, wow, like I literally just had like a near-death experience. Like things are not the same for me. Like even now, like my perspective is so different, because I almost died. Like me and my baby could not have, you know, made it. That's how I feel. Like that's how it felt. I just feel so grateful. Like I just feel grateful that I went to the doctor that day. I'm grateful that even though like I felt like I had no one advocating for me, because like my boyfriend had left and like the doctors were really like, you know, they're ready, like emergency C-section, nothing that I ever want. Like I never even, like this is something I never would have imagined would be my experience when it comes to having a baby. So I finally like go into like a room. I'm in a room. I get settled, like I'm in the bed, you know, have my nurse. I really liked my first nurse, even though I never saw her again. Like she was really nice and she was cool. So yeah, I'm just in the room. I don't really feel pain really. I think they have me on like, they probably have me on drugs, but I don't, like I'm not in pain or anything. I haven't even like looked at like anything down there, like as far as like my scar, nothing. I just was in the bed. We go to the NICU that night and I see her. She's so little. My baby was 1 pound, and basically she was like restricted in my stomach, so she hadn't been growing. Like she has like her middle, like her like stomach, like she's like a good size. Like she's long, she was like, you know, all the things, but she was like got to a point where like she wasn't the placenta, you know, she wasn't getting what she needed in there, which is another reason why both of us were, you know, we weren't helping each other. She wasn't helping me, I wasn't helping her grow, so she needed to what's it called, be, you know, delivered. So yeah, she's in the NICU, like she's in her little I don't know what you would call it, her little incubator thing. Yeah, so she was like in the NICU, like she's so super small. It was just so surreal to like see her. I'm of course still like nervous and scared because she's so little, so early, but she's strong. She's she's been doing good since the beginning. She's always been a strong baby, so there's no doubt about anything. But I was just like, wow, like we literally have been through so much. And basically I continued to like stay in the hospital. I stayed for like, I feel like 3 or 4 days, while they just monitored me and my blood pressure, like, because that's my biggest thing, is keeping my blood pressure like regulated. Even now, like, I'm on medicine to do that, to keep my blood pressure down, which they said is normal. That with HELLP syndrome, it's literally like until like the 6-week mark, I'm still gonna be experiencing that high spike in blood pressure. And that it really scares me, because just the thought of like me, you know, possibly could have a seizure, stuff like that, like that's one thing that stuck with me this whole time. And I had a lot of anxiety, like at first, especially coming home from the hospital. Like the hospital, I kind of felt like I got used to it, because one, I'm really close to my baby. Like going home was so hard, like I was just so emotional. Like even now, like I'm getting better, I'm getting more into like a routine, as long as I go see her and like, you know, do everything I need to do and know that she's good, like check in on her. I feel good. But like first coming home, I was a wreck. I just felt so guilty, because it's like, one, it sucks to feel like your body can't even like, you know, like it sucks that like I know I shouldn't compare my journey, but you know, I didn't have that normal pregnancy. I didn't have what everyone else has, where they can carry their baby full term and go home with them and be a mom. Like I'm a mom, but my baby needs extra care, and she's still getting taken care of. But at the end of the day, like innately, that mom instinct immediately, it kicks in. Like I gave birth, like it just like really hurt me, and I was very emotional. Like I was just crying, and I just felt so guilty. Like even like the fact of like going home and like doing my day-to-day things, because it's like my baby is still trying to get to a place where she can come home, but I'm home without her. And it's just so hard. Like it's the hardest thing ever. And I feel like, of course, this is teaching me patience and all these things, but it's just like, it's another example of like life, you know. Like it's hard, because like for me, I feel like, why can't things ever be normal for me sometimes? Like it's always like, sometimes always something, you know. Life is always teaching lessons, and it's like, I don't know, like I'm so thankful that like I'm okay, my baby's okay, like everything worked out how it's like should have. Like that's how I feel. Even though I had that emergency C-section, even though like they told me like I will never be able to like vaginally like give birth again. Like that's another thing. It's like I went through a lot, like a lot of things like came to the forefront of reality for me. Is like all the things that I ever wanted for myself, like when it comes to like having a kid, like it's out the window. Like no natural birth, no nothing. But I'm grateful. Like I have my baby, I have a healthy baby. Like she's doing everything she needs to do, she's on track with everything. Like she's strong, she's great. Like I love her. Like she is everything I could ever want. Like even through this experience, like it just showed me like life is short, and you never know. Like, and I feel like so blessed and just watched over and protected, because anything could have happened to me and it didn't. And I don't know, that's why, like, I don't know, being at the hospital, I just felt so like I got used to it, because it's like when I'm around like these people, they're helping, like they're taking, you know, they're helping me. Like my pumping, I started pumping. Like pumping is very important for her, because she is a preemie and she needs all those nutrients. So I had people helping me, like, you know, pump. My milk came in, everything is like, it was good. Just going home, I just felt so sad, like so sad. Even like now, like it's not even like postpartum, I feel like it's just like the situation. Like no one wants to go through a traumatic birth experience, and then on top of that have to leave their baby to be cared for by someone else. Like nobody wants that. So of course I've been super emotional, super just sad, and it's just like, it's just hard. Like I'm literally gonna have to wait like 2 more months for my baby to come home. Like that's not a very usual situation, you know, like at least nothing I ever thought I would be in. So it's just hard, but I know like I'm on the journey for a reason. That's why I'm like sharing my story, talking about HELLP syndrome, because I haven't seen a lot. I never would have thought like, hey, like I could possibly get this and have my baby at 28 weeks. No, like this is something I never heard of. Even searching it, there wasn't many videos on YouTube. So I just wanted to like share my story and share like symptoms and share like what I was going through, what I was feeling, because this whole time I'm thinking it's heartburn. I'm thinking it's heartburn. And if I hadn't have like had that appointment literally that day, I feel like who knows what could have happened, you know. Like I had already waited like a week with all these symptoms going back and forth in my head, like, hey, should I go to the hospital? Because of course I felt bad, but it's also like I'm reading and saying like, oh, this is heartburn, like this is normal, what I'm going through is normal, like I just need to take some antacids, I just need to change some of my diet, you know. I'm thinking all these things when in reality, like my body's literally like shutting down on me. I feel like it was just, hey y'all, I'm here pumping, but I forgot to add that my platelet count was low, like my blood platelets, so they also had to give me new platelets. So that's how bad like of a position I was in. Like I had low blood platelet count, so they had to give me new platelets and stuff like that. So I was very sick at the time of my delivery. Yeah, I'm very thankful, very grateful, and I'm very happy. I feel like everything happens for a reason, because I ended up not, like, of course I ended up at like a hospital, and everyone there was like no one made me feel like I was in a bad place. Like even the doctor, like even her, you know, me sensing like there was no hope from her vibe and energy. Like my labor delivery went good. I had my surgery, like I made it through. I ended up having like, there was like a Black doctor there who like, you know, was talking me through my aftercare, all these things. So I feel like everything happened for a reason. Like the nurses, like I went through a bunch of different nurses, but majority of them were very good, helpful, nice. Like shout out to them, because I don't know, I just felt like everything happened for a reason. Like I'm glad I gave birth where I did. Like who knows what would have happened if I would have went with mom doc. I never met a doctor from there. It was only physician's assistants. Like I probably wouldn't have met the doctor until I was going into labor. So like maybe, you know, like I said, everything happens for a reason, and I'm very like grateful and blessed that me and my baby are okay. Like we are okay. We're both doing great. I've already started to like, you know, be mobile, you know, like I'm already on the up and up when it comes to postpartum. Like it wasn't bad for me. Like when it comes to like my incision, all of that, I just like had a very weird, like weird little like ick moments, because, you know, like that's weird for me to like, you know, have a whole scar incision, and I don't do well with that type of stuff. I've never had a major surgery, nothing in my life. This is the most major surgery event that I've ever had to go through. So it was just different for me, but I feel like I healed well. I've been breastfeeding. Things have been going good breastfeeding wise. I have a healthy baby. Like she's doing what she needs to do. So I feel grateful. I feel blessed. I'm happy I made it through. And I really hope that this video like helps someone else, because it's very scary. Like very scary to go through what I went through. But obviously I went through it for a reason, and I just hope that someone else out there can learn and benefit from my video. Maybe the symptoms like will help someone. Like just maybe me sharing my story will make someone not feel alone, because I did feel very lonely. Like I don't know, I had my boyfriend. He was a great support. Like it just showed me like I have that support that I need. And I also like spoke to my mom. My mom's coming out, so like that's good. Like I have people who do care about me, because my whole pregnancy I did feel kind of lonely when it came to like my family and stuff. And then that happened to me, so it was just It was hard, but going through that has shown me like I do have the support that I need. Like it shows me like what my real priorities are, which is my baby at this point. Like nothing else is a priority. And yeah, I feel very blessed, very blessed. And I just want to thank everyone for watching. I hope this reaches the right people. I hope this helps someone. I hope me sharing my story, even though this is a condition that's like so rare, so random, so everything, I really hope it just helps someone, or even if it just gives someone like a sense of not feeling alone in the situation that they're going through, not feeling guilty, because I felt a lot of guilt when in reality there's no way I could have ever imagined or prevented this from happening. It's just something that literally happens. Even in preeclampsia, like it's a rare condition on top of it being a preeclampsia type thing. So yeah, I just want to thank everyone for watching, and I hope everyone has a safe pregnancy. And yeah, thanks for watching.